Okay, ladies, are you guys ready to dive in?
Yes, let's do it. Yes.
Okay, have any of you used a home blood pressure monitor in the past?
Yes.
Okay, so one yes.
Oh, no.
Yes,
Three
I
no's?
was my parents.
Yeah, okay, good. Well, it's the same concept, basically. And so what I suggest, and so let us know what you think, and Shola and I will kind of divide and conquer. So we'll divide you in two groups of two, and you'll each get a device, walk through the device, and practice the setup and explaining the process to one another. So you'll use one another as your your test patient, exactly. And then after you've done that practice walkthrough, then we'll do your checkoff. Does that sound okay?
One
Yes.
thing.
Mhm.
Can we go over the numbers again? Because that was, I know we went yesterday, but that's new to me.
Okay, so tell me, so then you mean like the
Like
goal cutoff
180
numbers?
over 90, if anything is higher than that?
Okay, so, good. Well, so let's go to the page so that we're all on the same page where it describes the expectation. May I
You
join
absolutely
you here?
can.
Okay,
Yes, ma'am.
let's find the page and then we'll,
Oh, 140 over 90.
yeah, so that's for the normal values. And they're also, I think it was in Shola's presentation yesterday, and Shola, you correct me if I'm wrong, that we identified concerning elevated blood pressure levels, so higher than 180 over 110. Okay, so those are, and actually then there were low limits as well that we wanted you to be aware of. So, first of all, the normal blood pressure cutoff. So the goal for most patients is to have their blood pressure less than 140 over 90. Okay, so top number below 140, bottom number below 90. And there are some groups of patients that you might hear have a lower blood pressure goal. And so those are patients who have kidney disease or diabetes. Some guidelines have recommended lower blood pressure cutoffs for those individuals. So you might find that you're seeing some patients who have slightly lower, but that's usually 135 over 85. Below that is the cutoff for those individuals. But for the most part, 140 over 90 is what you need to keep in mind. Now, if you're talking with patients or you're teaching them and you're checking their blood pressure and their blood pressure is elevated, so anything above 140 over 90 means their blood pressure is not controlled. So actually at or above 140 over 90. And so as you can imagine, so what are some things you would want to reinforce in that case? So if their blood pressure is 160 over 88.
Can we, at that point, can we do the confirmatory? Will you do three, or does the machine already do that?
So the home blood, that's a good question. So if you were in the clinic, that's exactly what you would do. You would do the 3 confirmatory measures and then use that average. And you'd ask them to sit quietly for 5 minutes before doing that confirmatory blood pressure measurement. That's exactly right. So, and even in that case, so you recheck the blood pressure and it's 158 over 86. So it's come down a little bit, but it's still elevated. What are some things that you might discuss with the patient?
Eating habits.
Okay, so
I would try to identify some of the foods that they're intaking and see are they high in sodium, because that does mess with your blood pressure. How often are they getting out of the house? Are they doing any exercise? So I would inquire about those things. I would still, once I get back to the office, I would definitely give those numbers to the provider and see on the medical aspect what they would suggest. But I also would talk to the we have a nutrition dietitian. I would speak to them, but I would, I would discuss with the patient and try to see if maybe we can come up with some goals that we can implement into their lifestyle, see what fits them, see would they be okay talking to the nutritionist, you know.
That's wonderful. And there's one more really important thing to ask about.
Are they taking medicine?
Are they taking their medicine? Exactly. And it's really important not to assume, because, well, exactly.
Right.
And so, and there are some ways to ask about that. So have you talked about promoting adherence yet? Has that been something you've discussed?
Give us an example.
Okay,
We may
okay.
have missed it.
So an example is asking the question in a way that patients are, so you don't put them on the defense, by asking about, taking your medicines. And why didn't you take your medicines? That's not going to encourage some discussion. So, one way to ask it is to say something like, it can be really hard for most people to remember to take their medicines every day. Have you, how many times in the last week did you forget to take your medicine, or you didn't take it for some reason? So that way, you're letting them know that a lot of people miss taking their blood pressure medicine, so that already they're okay with talking about it if they don't. And then you also ask it in a way where you're not just saying, did you take it? You're asking it in a way so it's not just yes, no, it's how many times in the last week did you forget to take it? So that kind of opens it up for you to talk about, well, what were some of the reasons that you forgot? Was it that you were rushing out of the house, didn't have time to eat breakfast, and you always take it when you eat breakfast? Or, you can walk through some of those barriers. But when someone's blood pressure is elevated, it's really important. So just as you've identified, talking about the sodium in their diet and physical activity, but importantly, are they taking their medicines? And help them to explore some of those barriers. So then the other blood pressure values that are important for you to keep in mind as well is the higher limit. So if the blood pressure, as I said, is 158 over 86, that's elevated, and we want to address that. So we either want them to be, more engaged in taking their medicines. They might need to actually have a discussion with their provider. It may be that they're taking their medicine and they need a dose change. So you want to certainly reinforce that. But also, there may be times when the blood pressure is very elevated and it's at a concerning level. And so that cutoff, because it's important for you to know and for you to be able to tell the patients as well, it's above 180 for the top number and above 110 for the bottom number. So systolic above 180 and diastolic above 110. So when blood pressure gets above levels like that, you want to encourage them to call their provider really right away and let them know that their blood pressure is high. And if they acknowledge, well, I haven't taken my medicine in 3 days, I ran out, or for whatever reason, then reinforce, your blood pressure is very high, this is very concerning, and it's very important for you to take your blood pressure medicine so that you can decrease your risk of having a heart attack, a stroke, or other negative effects of uncontrolled blood pressure. If they say, I am taking my medicine, then they definitely need to call their provider, because it's likely that they need some adjustment in their medication. And if they're having these elevated blood pressure at this level, and they're having symptoms like
headaches, nosebleeds, visual changes, and maybe you have weakness or chest pain, those things are indicative of target organ damage, and they need to get to an emergency room as quick as possible.
Same with shortness of breath.
Shortness of breath, there's a range of them.
And all of that, I think, is reinforced in the slides. So feel free to look back at those, and you might even make some notes for yourself for those key cutoff points, because that'll be important to know, and you'll want to have that fresh in your mind as you're seeing patients, so that you can counsel them appropriately. Also, at the other end of the spectrum, blood pressure can be too low. And what did we have the cutoffs? Is it below 80 and below 60?
Below 90, 60.
Okay, below systolic below 90 and diastolic below 60, and
But
with
with
symptoms.
symptoms, yes.
With symptoms. And if someone has that low blood pressure but they feel fine, you might just reinforce to them, why don't you call your doctor and just let them know what your blood pressure is now? Because it may be that maybe they've lost 20 pounds and they're able to back off on some of their medications. Maybe they don't need to push their blood pressure quite that low. But importantly, if they are having symptoms of lightheadedness, dizziness, feeling faint, and their blood pressure is that low, they really need to, call their doctor, and, if the symptoms continue, then go to the emergency room or the hospital. Okay? And those are really the most important parameters, I think, to make sure that you're aware of and to make sure that the patient's aware of. Because as we're coaching them to monitor themselves, we want to make sure that they understand what is the goal they're trying to get at, because that actually helps them reinforce, oh, this is great, look, my blood pressure is at goal today, so this medicine's working, I'll keep taking it. It's a very positive reinforcer, especially when they are achieving control or at least showing improvement in their blood pressure. Did you have any other questions about the blood pressure values? Okay, well, let's dive into using the devices.
So let's see.
Yeah.
So this is what it looks like when you get the pack unopened,
Beautiful.
right? So you open it and the first thing you see is the cup. Okay. So this is the cuff. It's a one size fits all within the range, right? The next is this manual, getting started, which details it details BP cutoffs and how to set up, essentially setting up the date and time, which is really important because for this home blood pressure monitoring, as we discussed yesterday, it has a memory and it's going to be storing blood pressure readings and values for specific days. So you want to have the time and date set up as soon as you open the map. So that's sort of like the first thing you do.
Sheila, I'm sorry, I wasn't here yesterday. My name's Mary, by the way, and thank you for all your help. I was wondering, for our patients who have low vision, the monitors are going to be great, but is there a way we can get the instruction manual in large print?
Absolutely. I think everything there. We have a participants packet, something to take home.
Okay.
So for people who have maybe difficulty reading, it's just easy to blow this up.
Yeah,
It'll be easy
some
for
of
them
them.
to read. Everything we have in here is detailed.
Thank you. Yeah.
Sort of like
That's a
quick
great
summary.
idea.
I'm sure you have it in your packet. Home blood pressure. Okay. So. Okay. And this is the device. It comes with batteries and an AC adapter.
I'm sorry.
So you can plug in or use batteries, but I recommend that you have the batteries in there.
Do you know what the life period is of the batteries?
They are alkaline batteries, so
Okay.
they last. Then of course you have the manual. So the manual contains things like instructions and error codes, because we can't print out all the error codes. So if some participants or patient complains that they're seeing error codes on the display of the device, you can just go to the error code section and see what each error code sort of corresponds to, so that you can know if it's a problem with the device or it's a problem with positioning or something, that needs to be done. This sort of tells you. So that's what we have in the pack. So the steps to go through will be, first, you want to be sure that the cuff fits. So we need to do an arm circumference measure, right? So we check the arm circumference to see if it's within the range 9 inches to 22. We use a measuring tape for that. This is a standardized measuring tape that we provided for everyone.
Thank you.
I'll describe how that's going to be used in a moment. Then the next step will be to configure the device. Important things to do: 1, set a date and time, as I said. And 2, you want to set it to the three readings mode. We want to take averages for the purpose of this study. If you do not do that, it's going to be taking just individual readings, just take one reading and stop. But if you wanted to run 3 successive cycles and take an average, you need to set that up here. It's called a true read function. Okay, so those are the things that you do. Any questions at this point?
I did, I'm sorry.
Oh,
You're probably wishing I wish you wasn't here today.
No, it's fine.
Going back to the instruction manual,
Okay.
is it, a lot of manuals now, it's in English on one side and Spanish on the other, is that how that one works?
Yes,
Okay, thank you.
English and Spanish.
Thank you.
Good question. So I think we'll have a big
Yeah, I was just gonna say, I'll pass it around for you to.
Thank you.
And you can see there's even a more simplified basic steps of blood pressure measurement tool there.
device and batteries. This is the manual. So you can just
No, right. Well, that's where having the,
Yeah,
you know,
that
the
one
more
don't
basic
read.
version.
This one.
Well, and that's why it's also so important to walk through it with each patient when you teach them how. Because you're right, that, instruction manuals can be very complex, even if the process or the procedure is really not that complex. It seems a lot more so when you're trying to struggle through a manual like that.
Is it possible, can we get our own copy of the manual and the instruction guide in case they call us and they're asking us questions? Like I've got this error code and I've done whatever it says, because I'm sorry, I'm visual.
No, so actually you'll each have a device.
To keep with us?
I believe so. Isn't that correct, Ariel?
I'm sorry, restate
That
your
each
question.
of the community health workers will have a device,
Yes.
a home blood pressure monitoring
Yes.
device.
Okay, wonderful.
Each person in the study, I'm pretty sure each person in the study will receive one of these devices to keep at home with them,
I'm sorry, I thought the community health workers were also going to have,
to carry around with them.
Mhm.
I don't know the answer to that question, but
Okay.
I'll find out and I'll let you know.
okay.
If anything, if it's just like the instruction manual with
Right.
the error code,
Okay.
because I'll know we'll get the phone call.
No,
So
I
are you
think-
saying that
I think
summarized
we
in
should
the document as well?
Arrow codes, no.
Okay, okay.
I think we should get one too, because I can imagine me giving this to my client and then I come back a couple weeks and saying, hey, where's, what I gave you? And they're like, I gave that to my sister because she needed it.
Oh no.
So,
Or, yeah, and it's like, I did everything the manual told me to do.
Well, actually, you bring up a really good point. And so I think it is important to reinforce with patients that we're providing this device because we're really dedicated to partnering with you to get your blood pressure under control, working with you to achieve your goals. And so it's really important that you keep this device and use it, yes. You may remember yesterday we talked about making sure that if they do have other family members who use it, to switch it to patient 2 instead of patient 1.
right.
And that's, where is that?
I just sent an email to Chittima, so I'll let you know when I get a response.
Oh, here, right there.
Okay.
So see 1 versus 2 on that switch. So they should always be 1. And then if someone else uses it, they just switch it to 2 and then before they use it again, switch it back to one for themselves.
And if they have three, two or three, are gonna have to decide who's two.
Any other
They can both
person.
be two, just to make, exactly, but the patient should always be one,
Always
and
be
no
one.
one else should be, otherwise we'll get confused in trying to interpret those numbers.
And I apologize for not being here yesterday, but what if we do
Okay.
have an obese patient?
So
So
that's a great question, we did address that yesterday. So only patients with arm circumferences as outlined here, so 22 to 42 centimeters or 9 to 17 inches can use this. We do not have home blood pressure monitors that accommodate arms larger than that. And so we want to be very sensitive to patients and certainly not make them feel negative, but let them know that we don't have a home blood pressure monitor for them that is appropriate for their arm, but we want to work with them to identify another way to get regular blood pressure checks. And so what we'll do is work with them to arrange for them to come into clinic and have efficient blood pressure checks using the clinic
So
monitoring device instead.
Two of us.
Well, I guess if they both arms.
I don't know, some of them are not.
Setting up the date and time.
The children who's gonna be in the study,
Mhm.
who's not gonna be in the study, but it's still in this brochure.
Yeah, it's a blood.
I don't think they're gonna be in.
We want, yeah, so I would have to look back at the inclusion criteria. I don't remember specifically that being excluded, but I would assume they'll have one arm, but maybe not. Or they might have fistula or something like that, where they're not supposed to have blood pressure checks. But I think those individuals probably are not included in
I
our
would
study.
think so.
But we could, that is an important question, but if it's due to the size of their arm, just reinforce to them that we want to work with them to make it, easy for them to come in for blood pressure checks efficiently, so that, you schedule them so that they can come in, they don't have to wait a long time, and, but to be able to, yes, but to be able to monitor their blood pressure in that way, using the clinic devices.
Sorry, I was listening, eavesdropping at the time.
Oh, okay, good, yeah, no, good, I'm glad.
So it was just,
Yeah, so that's great, yeah, get it set up, and
So you
then
just set it to the appropriate time. That's just it.
you can kind of practice with one another, and then we'll,
Today's 5:25.
No, it's not 3 to 7.
Oh,
No, I just left it at 7.
I thought you were.
So like I said.
So what are you going to do? Is this the seventh?
Yep.
Okay.
I'm just,
And
That's a little
3:18.
closet.
3:18.
3:18.
You can keep it 3.
Yeah, just,
Okay.
it's not gonna like mess it up.
then those are the up and down.
And so this is the first. It's fine.
Perfect. So you have the time set up. Then everybody just sort of go through this. This is how to set it to take 3 consecutive measures.
I
As
wonder
a true read.
That's the average.
Yeah. Right now the true read is off.
Okay.
Right.
Maybe it's about
So
show off.
you set it to on.
Huh.
It is
That's
confirmed.
smart.
Right. Now what this
You
means
need a
is
manual.
60 seconds interval. Like the gap in between readings should be 60 seconds, 1 full minute, but we want it to be 30 for the study, so you
30
just make it
seconds.
at 30 seconds.
Okay.
Oh, so it's incremental.
So that's it.
And this will be programmed for,
Yeah.
once you set it up? Okay.
Once you set it,
Okay, we want it to be 30.
30 seconds.
Okay.
So you can just repeat it.
Okay.
Okay, so those are the 2 things we want to sort of set up before we start, the date and time, and the true read.
We eavesdropped, so we set it up.
Oh, done?
You can check this out.
Perfect.
And we share.
The
so
30
not-
seconds.
So.
Oh, done? Wow, get an A plus. Okay.
So when you set for the true read, then what happens is, because I saw this happen when we did it, so we just continue, it's gonna go through this again.
Yeah.
And we'll just explain to the patient that, that it's.
essentially. But once you set it up this way, this stays that way. You don't have to do it each time you want to take it. Right.
So how do we get it to stop? Okay, well.
What's this button?
And that's the memory button.
Okay.
So for your last reading, you just hit this.
Oh.
Should it-
So they'll just get it their last.
No.
Yes. the last
Oh,
reading.
you can just.
But will it show the time or just the actual reading?
I'll show you right here.
I would try that out, but I think it shows everything. It's just like that, so it doesn't show everything. It just gives you the readings. But if you want those details when you upload them to the app,
Okay.
Now to look at the clock.
Well, cause I
you know
don't.
they have it log, right? So
I just wouldn't like, if I said, oh, when's the last time you took it? And she said yesterday, and I think the reading is like a week ago. I want to be able to see that.
so this is what they get for those who want to have it written down.
We have those, I think I saw that.
Okay. So once they take the readings, get it, do the 3 readings, and whatever this is displayed on the device, just fill it in there.
Okay.
140 or whatever.
Okay.
Right.
Now, I have a question. Should the patient be responsible for this, or should we be responsible
For
for
the patient.
the patient to
Yes.
keep track, and they will
track.
take it with them
Yes.
to the doctor?
Take it with them.
Because they're supposed to be doing their blood pressure reading even when we're not around.
Right.
We're just showing them how to do it.
We're just encouraging them to
Right.
write it. They're gonna write it in front of me.
No, they're not going to be, you're not going to be there every time to take the blood pressure.
That's very true.
Right,
Yeah,
so.
I mean, the first time
The
you
first
can,
time.
yeah,
Right.
and then you just have to remind them to put it, you know,
Put it in
I'm gonna
the-
give a little folder for them.
Can I ask a question about like having a smartphone and being able to download the app to be able to transfer the recordings of the EP?
Yes, I think we have
Is that in the-
instructions in
Is
there how
that-
to do that.
Okay.
Okay, so this is it. So this is what the app looks like.
Okay. So once we get aligned and stuff with our patients, we can just go in and.
Yeah, so
Okay, that's it.
the app is available for free, so you just download it and so think of it like sync.
That's pretty cool. I'm
Yeah.
interested.
But for those who are not as tech savvy or have problems with that, they can just use this.
Yeah, that's the end of the packet that she gave.
And it has to be emphasized that each time they take a measure, they have to.
Say something really important.
Absolutely.
You're gonna have to
Yeah,
take their arm
and
out of
we
that
emphasize that it's important for them to know
Didn't they go
that
over that?
we are not essentially using individual day level readings like that.
We'll keep it on there.
So it's an average of 5 to 7 day average. That the physician makes determinations based
And
on.
make sure they keep it on one for themselves.
One for themselves. One
And I think
for
it's a lot
themselves.
every time they use an adult swim bundle.
You'll go
I'm
through
like, I
the
know
whole
they're gonna
process.
check me.
We have to use something like that.
People that do when they use.
Yeah, the app allows you to.
The core.
So,
Is that what
are you asking where it should be?
Mm-hmm.
So there should be a mark on here that gives you and the patient a little coaching. Oh yeah, so it's actually here. Sometimes it shows a special little notch, but this should be. It's so cold earlier today. It's like you don't know how to dress these days. So you want it to be actually approximately 1 inch above the brachial artery. So it's above 1 inch above the bend and over
The flexure.
the brachial artery. So
Okay.
right in that range.
And the cord should be like this thing. I'm going
Down.
by the cord, okay, but I.
Yes.
Got it.
That's consistent with what it shows there, right? Yeah.
Yes.
It is saying the same thing, right? Okay, yes. And remember, if you have a patient with a funnel-shaped arm, so larger on top, it's okay to wrap it so that it fits snug to the arm. You don't want to be able to fit more than 2 fingers underneath the cuff.
So before we do that, let's. Yeah, this is how you make the determination of whether the clock is the right fit, right? Because it's the one, it's 9 to 22, so you.
What about the slope?
Just Okay, so let's go step by step.
That sounds like a good plan. Let's walk through it once, step by step, and then we can.
Oh, you're fine.
Which one? This one?
Okay,
You want to go through the checklist? Where is the checklist? Why don't we, want to just walk through that?
this is mine, right?
That's the one you gave me back.
Okay.
Was that one coming to me?
Yes. This is it. So this is this. So this is what we're doing. We're training. First, you fix the cuff. Then you go through setting up the device. Then you teach them the measurement technique. Then you tell them how to record in the log. And you talk about the action guidelines, what Cheryl described earlier. Your BPs greater than 180, 110, and you're having symptoms. What do you do? Right. Then, of course, you go through a checklist with them to make sure that they know how to go through all the steps. Right. So that's how you go about it. First, the cough. We need to make sure, it's really important to make sure that the cough is the right fit. Because if it's not, then we're not going to be getting correct readings. Right, so the whole essence of it will be defeated if this is not. Then setting up, measurement technique, everything we discussed that pertains to the same way the clinic measure is done. You sit, no talking, no crossing, don't cross your legs, and your arms supported. The 7 steps essentially. Then recording it in the log. Action guidelines. What to do, when to do it. Right, and checklist. So ensuring the cuff fit. So we're going to have the participant remove any clothing on the upper arm to, yeah, perfect. To reveal a bare arm. We'll have the participant please stand.
Don't let me step on your toe.
Okay. Oh,
So is our picture purple?
oh, you like purple?
It's important.
It'll be nice.
Okay. Holding their relaxed forearm horizontal and parallel to the floor. Good. Right? This way. So it's going to be in the L-shaped position.
Like you're holding the tray.
So you're going to use the standardized measuring tape, this, provided by this project, to measure the circumference of the arm at the midpoint between the bony protuberance at the shoulder and the tip of the elbow. Right. Just relax. Just like, good, perfect. Right. So the midpoint of this, that's the mid arm. What you want to get is the circumference. So bony protuberance here. To avoid bias, do you use inches or cm, centimeters? Cm, inches?
I usually do.
Oh, okay, so it doesn't matter. Because for me, I don't really think in inches, right? So I go this way, then flip it to see. No, because inches, it doesn't really register with me. Okay, so this is what we do. You mark the midpoint. I would advise that you use maybe a calculator or something, because it's not every time you get 5 cm that you can just divide by 20. It's 2.5. There are some numbers that it's just easier for you to use a calculator. Maybe I'm not good at math, but I use a calculator this time. So you do that, you get the midpoint, and then you draw the tape around. You mark it. Mark it. And then get the circumference. Make sure it doesn't indent the skin. Right. Then we read that off. In inches. Here we have 10.5. So she can use it because this is 9 to 20. Come Congratulations. Right. So for people that have arm circumference less than 9 inches, you can't use this, right? She has 10.5 at the mid-arm circumference, so she can't use this, so you can proceed. Okay, do you want to demonstrate?
And remember, the first time that you're introducing the machine to a patient, you'll want to actually go through the device too. And so describe to them, for example, what does the start-stop button do? The assumption is that you've helped them set up, you've made sure the battery is in, explain start-stop, explain the user ID button, as we talked about. So where do we always want the patient to be? Number one, exactly. And then the function of the memory button. So that's going to, so again, patient 1, and it's going to list the prior blood pressures. And,
Yeah, we've not taken any readings.
oh, that's okay, that's why it's not showing anything,
That's why it's
okay.
showing.
But you'll want them to know that they can use that memory button to go back and review their blood pressures. And let's see, the up-down function, so that's just going to allow them to progress through the
Okay.
past blood pressure measurements as well. And, well, the function of the cuff. So explain to them, you've got to sit still, it's going to take a few, to fill, for the air to inflate the cuff. You need to remain still until it's totally deflated, because that movement will actually influence their blood pressure. And then make sure that they understand the air jack, and that this has to be connected, and it has to fit properly in order for it to work. And what would you tell them if they, if it's inflating and it's becoming painful? What can they do? Exactly, they can just push the stop button, so inform you if you're there, but if you're not there, because they're doing it at home by themselves, let them know that is an option to press the stop button, so that they can stop that inflation if it's painful.
And then that won't count as a reading because it didn't go all the way through the process.
Correct, correct. And sometimes what happens, especially if people they're moving around and they're kind of active or wiggling during the blood pressure measurement, the machine actually starts inflating more. You'll hear it stop, and then it'll go, it starts popping up more. So remind them, sit very still and relax during blood pressure measurement, and that helps to prevent that overinflation. Okay, so you've walked through the device. Any questions about any of the
What does this button
buttons? Or any of the functions here? No. Okay, great. So you're going to walk through that so that the patient understands. And then what are let's do a little refresher. What are all the key points about good positioning for blood pressure measurement?
Well, yesterday there was a 7 to make sure that the patient arm was at the level of the heart, elevated with the heart. Also make sure the patient posture is good, his back is towards the chair, feet is flat on the floor, not crossed. Quiet, right? The patient is quiet. And
For how long?
Through the remaining out of the process of the blood pressure reading.
Right, but before pressing the start button, how long should
5
they be?
minutes.
Exactly.
5 minutes. So just making sure that the posture is set, that they're sitting up straight, they're relaxed, their arms level, they're not talking, speaking while the machine is doing the readings, and they're relaxed.
And there's one more thing that's on that list of 7. So what are the things that they should avoid for 30 minutes before checking their blood pressure?
Smoking.
Yeah, I think there's a lot. That's okay. That's why we go through it. And you know what? It's okay also to have a little checklist for yourself, so that and after you do it, a couple of times, you'll become much more comfortable about what are all those key steps. But you were almost there. So just, you know, and it's, you know, there's kind of a fine line there too. So the blood pressure will be more accurate if they have not smoked cigarettes or drank alcohol or caffeine for 30 minutes prior to the blood pressure check. Now, is it better to have a blood pressure than no blood pressure? Yes, probably. But we want the most accurate blood pressure, so we want to make sure that they know when they should check it to make it the most accurate. Oh, and one final thing, empty their bladder. They also should have an empty bladder before blood pressure measurement, okay? And you want to make sure that you teach them that, because a lot of people don't understand those key concepts of accurate blood pressure measurement. So it's really important to make sure that they learn that from you, because they may never learn it if they don't learn it from you.
And I think for some people it's just automatic. When they sit down, they cross their feet at their ankles, and they don't even realize that they're doing it. So that was when I was in the doctor's office, that was the big thing. It's like, you crossed your feet. Cross those feet.
Okay, so those are the key steps. So you're going to make sure that they also understand that either the battery has to be working or the device has to be plugged in. And you know, it may not be a bad idea just to remind them to plug it in when they can, when they're not using it. That way it will always be functional when they need it. And what are the best times to check blood pressure? Actually, best time may not be the best way to ask that, but if you're going to, when we ask someone to take blood pressure 5 days in a row, for example, when would we like them to do that?
I remember yesterday was saying make sure they stay consistent within a time. Like if they get up in the morning and check it at 10, you know, be consistent the next day 10 and 10, and stay consecutive. But would morning time be a good time to take action?
Exactly. So actually it is. So, and we want to know. We want to know because some individuals have a normal variation also in blood pressure, and so that can be helpful for us to understand. And it allows us to look at how the medications are working at different times in the day, you know, depending on the kind of dosing that they have. And so a morning check and an evening check is ideal, to check it twice a day for those 5 days that we're asking them to check. And many of these patients, we're actually asking them to adopt this as part of their everyday management of their high blood pressure. And so, you know, you want them to help build it in with their routine.
So for the evening check, it's either 30 minutes before dinner or 30 minutes after dinner, whatever they prefer to do, basically. Not right before they go to dinner.
Well, I think it could be right before they go to bed. Yeah.
Yeah. But they just need to make sure that they've not eaten within 30 minutes of taking it. And whatever time they decide to take it, try to stay true to that time.
Okay.
And just to touch on what can help you sort of remember the steps, we discussed yesterday, prepare yourself, prepare the device, take your blood pressure, so that you don't forget to empty your bladder or forget to exercise, eat, all of that. So you know that you need to prepare yourself and prepare your device. Make sure your switch is set to 1, right? Plug in the device, set it on a flat surface, you know, all those things have to be in place before you sit down. So take a 5-minute rest and take your blood pressure.
Do we have a cheat sheet
Cheat sheet?
for the patient
Yes, this is.
in regards to, okay, I'm new at this, and I know this community health workers really well in explaining it to me, but I can't remember all the steps. So that they have this, that they
Yes.
can just kind of do their own little check.
Perfect.
And that will be important, because you're right, you can show individuals, and a very effective way is to demonstrate for them and then let them teach you. That way you hear what they've understood, and so as they walk through it, they can actually explain exactly what they're doing, explain every step to you, and you'll be able to catch if they're missing any of those key steps. And you can reinforce that and refer them to the checklist or the cheat sheet, if you will. Hey, we all need cheat sheets.
Your fact
I
sheet.
totally
Your
agree,
fact
exactly. So do you want to work with one another and actually walk through the process of, introduce one another, or, well, let's ask you, I mean, do you feel like you're ready to do a check off, or would you like to walk through it when, you know, we walked through it, do you want to walk through it together?
Yeah, you can do it one time.
Okay.
And start off with this.
Okay, who will be our test case?
Lauren.
And actually, if you want to do it at the same time, you can, and then, yeah.
Okay, go ahead. We have another tape measure?
Like if they decide.
No.
I don't remember one.
I have it in my car. I carry it.
Well, they'll be.
In regards to the actual piece itself, we have the box that it comes in. Does it have its own case, or they can put it back in the box?
It does not have a case, no.
Okay.
The box, I just opened one up and there was no case in it. Yeah, so some of them come with like a little zip thing,
Right.
and so you might, encourage them to keep all of the pieces together,
Exactly.
so that and really it's the three pieces. So the AC adapter, the device, and then the cuff and tubing are one piece.
Great, thank you.
Of course.
So, this is my patient, she would be standing straight up. Anatomical position.
Relax your shoulders. That's what I.
That was a visible relax, I like that.
You need to see the bony protuberance.
Right here?
You need,
Right there. Oh,
yeah,
I
it
need
has
to
to
see
be,
it.
exactly.
Okay. So don't do it over the clothes, please.
Yeah, definitely.
Well, see, that's what I was gonna say, if you wanna, if you wanna slide your arm out of the sleeve, but it might be a little too up close and personal for everybody in the room.
Yeah.
I mean, I'm fine with measure, I mean, it's gonna be like from here.
Okay, so
Right on the fatty part. Or the
the midpoint.
The midpoint, right, would be 8.
To your elbow,
Okay.
and
So
then
you have
it's
to
gonna
mark
be
it.
half,
Right.
and then I'm gonna go ahead and do
And I did
measure.
this, so I won't walk.
Yeah.
I'm not trying to be fresh. And then just go ahead and from the half mark, I'm just gonna go ahead and measure here to
Just
see
round gently without
if
making
you're,
any
Without
pressure
making
to the
or
skin.
within. Grace is not my name. So you're fine, you're fine.
12.
Okay.
So that she falls in
Within.
perimeter, which is 9 and 22.
We're going to tag team it with our tape measure here.
So do you want to measure?
Oh, I see, I was looking for that.
Oh,
Okay, now, would you mind, now, would you mind having a seat for me, please?
I just learned that word.
Enjoy it, embrace it.
Is it okay if I sit just
My
on
hand
the
is
phone
fine.
beside you? Okay. She's already put herself in the position.
yeah, just make sure.
Ma'am, can you please brush your legs? Alright, on blood pressure, make sure I get accurate reading. Do you have to go to the bathroom? No, okay.
There you go.
I was already asked if she was smoking or not.
I know it's gonna be kind of awkward. You'll get that, you'll get
Number
it.
10, I waited
Yeah,
the
so you're
timer.
Yeah.
Okay.
And you need to make sure
Okay.
the device is set
Is
up.
it on one?
It's on one.
Okay.
And at what measurements would you not be able to use this cup?
If she's smaller than 9,
Mhm.
and then bigger than 12.
So
No.
because this is her own,
The good thing is,
Oh,
it's right
okay.
here, smaller than 9, and 17, but you can always refer to the cup to confirm.
And
Ad hoc level.
supported,
You can sit down, patient.
remember?
Well, thank you much, CHW.
The chair is not good.
Okay, patient.
This is beautiful, I'm so excited.
Is
You
yours?
can move up closer to the table.
Table.
So but my husband can use it too, right?
Well, your husband can use it, and we'll explain that.
Oh, he's gonna be so excited too.
Yes. So.
And I can just measure him like you measured me, like right here at the bony protuberance. Is that what you call it, down to the elbow? Oh, cool beans. Because we have a tape measure at home. I mean, upstairs.
Well, this one's yours.
Oh my goodness. He's not gonna like purple because he doesn't like the red.
It's okay, tell him so.
Yeah.
So for this, we're gonna keep you on 1.
And a head cold.
Because I'm number one.
Because you're number one, and we also want you to be able to keep track of your blood pressure every week. And if your husband has seizures,
Are you possible? Yeah, not because he's stinky.
Right. So this is the start button.
So ideally, we wait, so we wait for
Obviously,
5 minutes.
when you're ready to take your blood pressure, you'll hit start. And when you're ready to stop, you're gonna hit stop. This button. We've already set this up for you, so it has, how many seconds you've been what is it called?
Measurements?
They're just
Oh,
called
inflation.
measurements. In between the inflation, it has the year, the time, the date.
So is we
everything.
gonna average all three of the reasons?
Look in the menu when you wanna document it, wherever the sheet is. So they'll tell you whatever your blood pressure was, and then that date.
Okay, and then so like, I know you gave me my little power surge too, so if you have like a power surge and this goes out, then you showed me how to set it, so I can reset it.
Yep, and this is battery operated, but when you're not using it, it would be great if you would keep it on the adapter. Okay? Alright, so I'm gonna take your blood pressure, so we'll have that done for today. Just remember that when you are taking it in the morning, in the evening, so you'll log it,
I'm sorry.
and then try to take it at the same time every day.
So excuse me.
What do you want to tell her about positioning?
So for your positioning, can you scoot you up a little bit?
Absolutely.
I know you have a boot on, but we want to keep your feet flat on the floor.
But it is flat.
Sit up tall and sit back. And can I keep her arm right here? Is that?
So where do you want it?
I know it has to be by your heart.
Level. So what I would probably do is, I think that's probably right where you want it, at that table.
Okay.
And resting on the table is good positioning for that.
And I can always take this off too in case you don't think it's as level as you want. Because I know you don't want me walking while taking,
No, I don't want you walking.
even though it's portable. Oops.
And so anything else about positioning or how she should prepare herself every day?
I have to pick the ladies.
So that's important, so we want to make sure that your bladder's empty when you're taking your birth.
And so the bathroom's upstairs, but I have to go up the steps, so when I come back downstairs, I need to sit for 5 minutes, is that correct?
Yes, for 5 minutes you want to sit and be relaxed before you take your blood pressure. So make sure this is right on the table, wherever you're going to take it, so you're not resting for 5 minutes and going to get any kind of water, sitting back down.
Okay.
That was the purpose. And before you take it, you don't want to have anything to drink, or if you smoke at all, you don't want to do that.
Or what to drink? What are the things that actually increase the blood pressure?
Alcohol.
What, no Bloody Mary or
No Bloody Mary, no coffee.
And coffee, exactly.
And so my Diet Coke is out the door?
No Diet Coke.
No
Caffeine,
Monster?
exactly. Yeah, no Monster Rock or whatever. I think you got it.
What happens, I have my cell phone and I know we're gonna do 3 readings, can I talk on my cell phone?
Yeah, we have
Be
this
quiet, tell
to
your husband
indicate
go in the
that
other
the
room
color
for 10 minutes.
is
while you're
automatic,
doing it.
makes a
Are you
feature
kidding me?
of
I'll be
this.
completely
So green
quiet for
is
5 minutes. You might just
so
wanna sit
it's
down because
good
I'm
that
quiet
so
for
it's-
5 minutes.
That's fine.
If it's
not-
So we're gonna now pretend that you've been
it's
quiet for
orange,
5
it
minutes.
usually means it's pretty high potential range. If it's
We're
red,
going to
then
just
that's,
stop getting cold.
huh? So,
You don't know what not to wear when doing that.
I'm ready.
Oh, great.
And how do you want to tell her to position the cuff?
So on the front of it is actually a picture that says how to position the cup.
Sorry.
So you can,
Oh, that's right, so you can refer her to the diagram.
So I wanna see like the bend in my elbow and maybe a little further up.
2 fingers more.
Yes.
Does her arm need to be like this direction?
So as long as, so you can get the cuff on in the proper position, and then you can get her arm where you need it to be, because I can see you're kind of struggling. Yeah, so the main thing is to have, so where do you want this to be? The two,
Here.
yes, exactly. So you might need to just, yeah. spin it around a little bit
Is
there.
it gonna be easier if I do?
Yeah,
that
probably
for
so.
now?
Yeah, so get her set with the right positioning. Perfect. That's exactly where you want it.
I know you do the shoulder.
And then the cuff, and remember you want the cuff tight enough that you can't get more than 2 fingers underneath here. So you may need it a little bit tighter than that, okay? So, because you want it to be really firm, snug against the skin. So feel how that's, okay? And then you've got the tubing exactly where you want it, the center, and about 1 inch above the bend of the arm.
So that's good, it's kind of like 2 and 2. I don't want to be able to put two up in there, but I don't want to go 2 up. I'm sorry. This is my husband's idea of the perfect kitchen table. I thought it was too high.
Nice, I'm 22. Like you are. I can have you take a seat. You're gonna have your arm crossed up, so you're correct.
Oh, that feels tight. Oh, that's too tight.
We would hit stop.
Although it's already going down, so. And stop talking, please.
And relax.
Yes. And I'm gonna make sure you're not to go to the bathroom or that you'll be good for 30 minutes. And then smash it in 30 minutes.
No exercise.
Or exercise.
It is kind of difficult sometimes because
Okay.
patients do want to talk with you, because you're there with them, they want to talk, so just, please, remember, don't talk while we're checking your blood pressure.
3 times.
Hey Cheryl, how you doing?
I'm great, how are you?
Great. Can't remember anything.
Our brains are fried.
You guys are amazing.
What's my name?
Yeah.
Get a name tag, you don't need to
Yeah.
remember it.
Just look down at your shirt every time.
So you want to make sure that you hold nice and still.
It was something that I was trying to get.
So while the blood pressure is measuring, I'm going to ask you a couple of questions. So, how would you talk with the patient about the goal blood pressure, and what is the blood pressure they're working towards?
If I'm doing a home visit, I would think I would have
I'm gonna go watch
patients,
Lucy.
at least part of the chart that has their blood pressure with the averages and everything. And then I'll also have my own sheet, so I don't tell anybody if they're wrong.
Yeah.
That the ideal blood pressure we
Yeah.
is 140/90.
Is it at 140/90?
That's
Or
good.
anything, a little lower. Yeah.
Exactly, so you want to be below 140 and
I think
below
I might do
90.
the same thing tonight.
And
You're
anything
doing
over
anything
that
later?
is considered not controlled.
Well,
So
okay,
then
good.
if it's
We
not
got this
controlled, then
sometimes,
I
we've been
wanna
talking about it.
make sure I'm asking her questions about,
Alright.
her medication, if she's taking or not, or eating
Alright, better.
habits and things like that. And then anything below, maybe over 60, sorry. I wanna call a provider, and then anything from, 180 over 110, I also wanna call a provider.
So if it's below 90/60, especially when there are what symptoms? Concern.
Nausea, blurred vision, tiredness.
So that's actually more for the higher blood pressures. Well, fatigue, so at a lower blood pressure, an individual may not be getting enough blood flow to their brain, and so they start feeling lightheaded, faint, dizzy. That's when you're concerned. So those symptoms tell you that blood pressure is probably too low for them. That's when they need to call the provider. And then at the other end, that higher end, which you got the cutoff right, above 180/110, it's especially when they have symptoms of nausea, headache, they might be short of breath or have chest pain. That's when you definitely want them to, even without symptoms, they need to call their provider and let them know. With symptoms, if the symptoms remain, they should either call 911 or go to the hospital, because with those symptoms, that's very concerning. So, how would you describe this blood pressure?
You are 109/15. That's normal for you? Okay, good. So, she's fine.
Yeah, that's well-controlled blood pressure.
Yes.
Great. Okay, and,
Probably before I have to get in the car to go home.
and what is she to do with that blood pressure?
Documented in our log that we gave you.
Okay, great. And some patients actually may have, I think, I know. These devices will link with an app. There's an app that they can download if they have an iPhone, and they could actually capture those blood pressures there, but if not, we definitely want them to capture it on the blood pressure log.
And did you say that they could take their machine with them when they see their primary care for follow-up, or just?
Well, if they can bring the device, if they, especially if they want to do a comparison to confirm blood pressure. Some patients feel more confident after doing that, especially if their blood pressure remains high. They might think, oh, it's the device, my blood pressure is not really high. And so in that case, you can encourage them, why don't you bring that device the next time you go to the doctor? And then you can go through the process of having your blood pressure checked with the clinic device and with this for comparison. But if they're maintaining the blood pressure log, really that's all that we need. You did a fabulous job. Great. Checked off done. So let's switch and, okay. Do you have any questions about anything?
No, I just need to get comfortable. This is like my first time even touching a machine.
So you know, Raven, practice with it. So, Ariel, did we get an answer yet whether they get to bring one?
She was double checking.
Okay,
She didn't
okay.
want me to give.
Okay,
the
okay.
final
Right, okay.
response.
So let's find out, because it would be, one of the best ways is if you practice with it yourself and get to know, even check your own blood pressure with it, you know, a couple of days, and then you'll become very comfortable with it. And as you do that, think through every single step to reinforce how you're going to describe your patient to do it, okay?
I do have a question. My parents were really excited when I did my CPR training. I'm like, Dad, can I practice?
Oh, goodness. Don't practice CPR on anyone. Okay.
Some people have isolated.
We're here today because I'm bringing you your home blood pressure monitor. This is so,
Yeah.
right, so what your doctor wants you to go ahead and do is measure your blood pressure here at home between now and the next doctor's visit. And we talked a little bit, this is the law, and this is going to be important too in regards to taking care of your blood pressure.
Well, I know we said yesterday that
We want your
blood pressure
pressure
is
to
very,
be
very
below
low.
140
It's
over 90,
if you're
especially
stressed
with
about
your
it,
medication,
time,
and we talked about your diet and some exercise that you
things
think
like
you
that.
would be able
Those
to
things can
do
impact the blood
between
pressure
now
if you
and the
raise it
next
up or
primary care
stress.
office, so that's going to
Essentially,
be
those two things can
fantastic.
really impact. So
And then so with the
that's why
monitor,
we
at this
recommend
point, we're just going to go over the
that you
monitor,
recommend
and we're going to go
tests
ahead
that
and
we
do
have
a series
clinical
of 3
determinations that are
readings,
made
and
based
then
on
with
one
the 3
reading.
readings,
I can't
it's
just see
going to
this
help
reading
you
now and say, oh,
determining
this
an
is,
average
you know, you're
for
hypertensive, I need to start your medication.
understanding your blood pressure
Clinical
and
determinations
treatment.
based on this, on the whole
So
blood
with the
pressure
machine, we have the
readings.
start and stop button. We have the
Based
arrows that go
on
forward and
It's
backwards.
set of readings,
Um,
starting with a 5 to
Mhm.
7 day period.
The system right here is when we set up the machine, we went over this, and we set the time and the date, and then, we also have this.
Yeah, so it might just be anxiety at this point.
Little notepad right here, and that's gonna go ahead and keep your blood pressure readings for you.
So that's what happens.
And that will show like the timing, or the readings, and did you say it does take the date?
It is technically yours.
It does,
Okay.
but it only holds a certain number of values.
So many.
Shola, do you know how many blood pressure values does the memory keep?
No.
So what you don't want, we can confirm that by looking through the manual, but what you don't want is the patient to think they don't need to write it down, because it only holds so many in the memory. So that's why we want them to keep the log and keep track of it that way.
No.
What?
I'm looking at it right now.
Okay.
So even though that it does keep, the readings, there's only a certain amount of readings that it stores in its memory, so it's very important that you work with the log as well. With the log, you want to take it in the morning, take it in the evening, and you want to be consistent in regards to your AM and PM times. You want to be able to sit quietly for 5 minutes. You don't want to drink any alcohol, any caffeine, coffee, monsters. You don't want to smoke. And we talked about your smoking sunset.
as soon as possible. And so, you don't want to have your cell phone by you, don't, because you don't want to talk. You want to keep your feet flat on the floor, you want to keep your back supported, so nice and straight, just relax. Think of it as a radio. So you're doing this for a reason. This is all about you and taking good care of yourself. So another thing too is, I think one of the medicines that you're taking for your blood pressure is HCTZ, and that might cause you to have to urinate more anytime you're going to the bathroom. Yeah. So just make sure you empty your bladder.
200.
That you, okay. Oh, 200 read?
Yep.
I'm not going to tell them it's 200.
But it's 100 per user, so it's 100 for user A, 100 for user B.
Thank you. So you just empty your bladder. So we talked about your feet. You want to uncross your feet. You get the measurement of the cup, and everything is perfect. You fall within the range, so that's good. We're gonna take the cuff and I'm sorry, my hands are cold. I used to say sometime in the office, I'm so sorry, my hands are cold. But see, if you have a long sleeve, you don't want it to be binding, because that can give maybe an inaccurate blood pressure reading, and we want to be as accurate as possible. So think about the short sleeve and the sleeveless, okay? And what I'm going to do right now is I'm going to go ahead and put the cuff on, and I think it's going to be easier for you to have the good place to get the blood pressure here. But then when it comes time to do the reading, I'm going to have you go ahead and have your arm here, because you want your cuff to be arm level, or heart at your heart level. So let's stick that a little bit right now. So you're just going to go ahead and slide it on.
No, people
Okay, and I use the two-finger approach here.
This intervention if the usual
Right. There's this vein that you have. So think about the tube is always going to be facing your forearm right here, and then think about that you have this vein. You kind of want to get it where your vein is at. So when we put the cuff on, you want to do like about 2 fingers up from where the bend of your elbow is. So we're going to make it a little bit higher. And this is going to be tough because it's under the thing they do. Okay, and then I know it's going to feel snug, but we're going to go ahead. So when we put this on, we don't want to be able to slap 2 fingers in here. Okay, so I'm going to make it maybe a little bit tighter. Now sometimes when you do your blood pressure reading, when the cuff inflates, it feels tight. However, if you feel that it's too tight, just hit the stop button. All right, it won't take that reading, but you'll be fine. You can start it over again. Okay, nice and comfortable. Those feet aren't crossed, right? Okay. So, we talked about the button. We've got start and stop, so we're going to go ahead and start.
Yeah, sure.
Okay, the first reading, I want you to be quiet. And then I know that your doctor was talking to you about some of the ways to maintain your blood pressure, and we talked about one thing too, since you're taking medication, is you have iron that we're talking about, 180 or anything like that happens, and if I'm not around, what you want to do is you want to call your primary care. But if you're feeling faint, dizzy,
22 centimeters. But 17 inches. No, it's why I just like to stick this into the
Another
picture.
thing is if it's lower than 60, the doctor may need to medication.
When you should be talking while you're doing blood pressure correctly.
Oh, I thought you wanted Raven to interact with me when we were doing the blood pressure reading. Oh, yeah, because that draws them into wanting to talk back to me. So all right, I'm sorry, I misunderstood because I thought you wanted.
No, and I think I was asking questions, so maybe that was confusing. I apologize, because you want to teach them to sit and relax and quiet.
Right.
And so if they're paying attention to you,
Right.
Oh, I can be quiet.
everything you were saying, all of those things you were saying are absolutely appropriate, and you do want to say that either before you start the blood pressure measurement or after.
Okay, all right.
Okay, so very good.
Trained as
much as possible to understand.
But you were right on track with all of your counseling.
Okay, so do you want to go through the checklist? Okay, so two things.
Feels like a long time to
Essentially, you're going to be describing what each of these buttons, the components.
So this is the star button. Once the patient probably sitting up in a position to get their blood pressure reading. So make sure that's always going along for the patient. But then strictly
One thing that you can do on the board, just because the device was already together, you just want to make sure you explain to them. Because just because it can be confusing, the AC adapter, they don't fit in the same one. They're different sizes, but.
Not leaving anything to chance.
Okay, so blood pressure measurement is complete.
You're done, it was a flash 5 minutes. So I'm just gonna go ahead and help you out with this for right now. Alright, now, I know we were talking a little bit before about the machine before I put your blood pressure. Do you remember what I said, if you needed to see your readings, what button to press? Could you show me, just point to the button that you want to, or do you want to go ahead and press it now?
Bladders empty, sugar solid.
That's wonderful. And then what do you want to do with these readings?
Elevated heart level.
And then tell me something else about the log sheet. In regards to when you're taking the blood pressure, you're going to take it how many times a day? And then do you want to take it when during the day?
What it is? What's the
Okay, and what's important about taking it in the
Be able to
AM?
review your readings.
Can't have my staff room.
That is
That's
important.
And in the PM, I want to take it either before each or 30 minutes after.
Okay, and then,
So they won't be.
we talked about, I know we talked about a lot, so if you have any questions, don't ever hesitate, you can always call me, we can go over it. But in regards to your timing, you want your times to be consistent, so if you do it, 9:30 in the morning, maybe at 7:30 at night, or just, make sure that it's 9:30 or as close to 9:30 as you can, 7:30 as close to 7:30 as you can. All right.
And how about this blood pressure level? How is that?
Yeah, well, your level is 107/64. This is good. If I had a gold star, I'd put a little gold star next to your reading. Keep up the good work that you're doing. I mean, your number, you're not above 140 over 90, and you're not below 90 over 60. And those are kind of like magic numbers that you want to go ahead and keep in mind. And do you remember what I had mentioned about if it gets over a couple numbers that I threw out there, do you remember what those numbers were? If it was really high and elevated, we talked about maybe calling.
I don't remember actually. You told me to call Dr. Johnson.
Okay, 180 over 110.
Can we write that down?
Oh, absolutely, absolutely. What I'm going to do is, this is your log, and there's nothing on the back here. So I'm just going to write like what elevated numbers are, what your heart is, what we talked about, what the doctor talked about in the office, and if it goes low. And then in regards to high, just a couple, some of the symptoms that if it's high, what you're looking for, and if it's low, what you're looking for in order to call Dr. Johnson. Do you have Dr. Johnson's number in your phone? Okay. Well, I have it in my phone, so I'm going to pull up his number. I'm also going to write it on the back of this page. So everything is going to go in one place in regards to you have your
That would be more of a technical question.
measurements here.
You've
And
got
people have
your
different ideas about it.
number
Well, she did
information,
say
and I
she
even
would,
have a
just
highlighter, I'm
be sure.
highlighting jobs and sounds with it.
Just in case the battery.
Yes. And then you have, here's the card, and again, if you have any questions, take your time, read the manual, look at the instruction booklet. Don't hesitate to call. I'll get back to you within a day. That's our standard
But if
procedure.
do you have any questions that arise during the
Well, you
Well,
ladies
I
did a
have-
great job. Congratulations.
Thank you. I
I
have
think-
Hopkins business cards.
Oh,
Yeah. I can get you some Hopkins business.
Okay, so Nicole, about the
That way,
device then, like,
patients, you have a way to reach you if they have
just demonstrate. You want to go first?
I can do that. So just do it again.
Whole process?
Okay, ladies, excellent job. Any questions about anything? So what I would say, use the device and know that if you have any questions, don't hesitate to reach out to our team at any time. There's also a website with frequently asked questions and our phone number, so don't hesitate to reach out. And we're happy to, whether you're in somebody's home and you got the question then, or just something that you keep hitting against, don't hesitate to reach out to us. But practice with it a little bit before you go into someone's home. Walk through the whole process, practice on your mom and dad.
Something to add is I actually added all of your emails to the website, so you can access those training videos that we watched yesterday. So if you guys want to do that,
A little
just
refresher.
type in your email address into the Get Trained box, and you can do that.
Okay, and I won't have the problem like I had yesterday.
Uh,
I talked a
what
little
site
bit.
were you trying to access?
Well, Joe had sent me links in my email
Okay.
for the three.
Oh, no, because,
Okay.
no, you won't have those problems.
Okay.
Because they're all centrally located on the
Okay.
website. If you're trying to access them individually, that's probably where it was taking
Because I told Joe, I was like so
Yeah.
excited, the first one was wonderful, I was like, oh, I can't wait to see the other two. I was
No,
like,
sorry about that. No, now you can, if you just go to the richlifeprogram.org
Okay,
and then get trained, and then just type in your email address right there, and they're all located.
okay, wonderful, thank you,
Yeah, no problem.
yay.
So do we need actual checklists? I mean, they're here, but
They're
I don't
located
know
on
if
the
we're.
website now, so I don't think.
Okay, we're
I don't
not
think so.
capturing them.
No.
Okay,
Okay.
I didn't know if we were documenting it in some way.
No.
Okay, well, thank you, guys.
Thank you, thank you, thank you.
Good question. I'm sure, there's one down at that end too, so, I think this one probably does belong to this. So for now, it sounds like we're keeping these devices, but I know Katie said yesterday we were gonna figure out, develop a plan for storing them, but getting them to you when you need them, but not burdening you with tons of boxes to store.
We're gonna do 3 books, so just 3 and still 3.
Is there anything else that you need?
I'm gonna turn this off. I think